Is your teenage child struggling with seizure-like symptoms or an episode, and yet tests like EEGs are coming back normal again and again and again? As a parent, you might be wondering, but more importantly, confused and frustrated, what the heck is really going on with your child's health, because nobody's giving you the answer. I have worked with hundreds of families just like you, feeling very confused and lost after countless tests that lead to absolutely nowhere. If that is how you're feeling, you're not alone. I am here to help you to understand what's really going on with your child. So in this video, we're going to break down why tests like MRIs and EEG keep coming back normal, and yet you know that things are not normal for your child. I'm going to explain why these tests do not really capture the full picture of what you're actually seeing and what you can do as a next step as a parent to really support your child. So let's dive in. And I'm going to start with really understanding why an EEG, even though it's a standard test for detecting epilepsy, may not show anything, which is really puzzling despite your teen's seizure symptoms and episodes. The first step in understanding this mystery is to really understand what an EEG actually does. An EEG is one of the first tests that doctors use when they suspect your child might have an epilepsy. But did you know that it can come back normal, like completely normal, even if your child is having these non-stop seizure-like episodes? Let me explain why. I've seen tons and tons of cases like this, but let me talk about one of the child that I've seen. Let's just say her name is Emily. Emily was a 15-year-old female who was otherwise pretty healthy until one day she started feeling kind of off within herself. Couldn't explain exactly why. And next thing you know, she was having like on the floor seizure, like full-on convulsive episode. And she was in school. Of course, the school got panicky and called 911. Parents are called. She was taken to the ER by an ambulance like this was life-threatening emergency. Obviously, because nobody could tell what was going on. And at the ER, doctor, of course, ordered an EEG because they suspected, oh, this girl might be an epileptic seizure. And guess what? The EEG came back completely normal, even when Emily was having a seizure-like episode while she was getting an EEG. It was really, really puzzling for everybody, including Emily. It's like, what is going on here? And of course, the doctor told the family, well, EEG looked normal, then everything looks great. All the blood work, other tests come back really normal. So we can't find what's wrong with her. And she was sent home from the hospital without needing any treatment or any other recommendations because doctors couldn't find anything. And as a family, of course, they're not going to be able to take that as an answer. So they were still looking for those answers. Like, what do you mean everything looks normal? This is not normal. My child is healthy and having a seizure-like episode is not normal. Here's the truth. The truth is EEGs are designed to detect brain activity during seizures. However, they can miss non-epileptic seizures, also known as PNES or functional seizures. So even if there is no abnormal brain activity in your child can still be having the real seizure-like symptoms. This is exactly what Emily was experiencing. So what's really going on with your child's brain? I mean, could there be an underlying neurological condition that EEG is not catching, or what else is going on? Well, let me explain. Well, there is this hidden condition called Functional Neurological Disorder, short for FND, that causes symptoms like seizures without showing up on standardized tests, including EEG or MRI or any of that stuff. So let's talk about what FND is and why it might be the missing link for your child, just like Emily. So again, back to Emily, she continued to have these seizure-like symptoms. And one of the things the doctor at the ER actually told the family was, well, we can't find anything in EEG, MRI, CT scan, everything else. So it must be psychological. Better yet, it must be Emily's stress and anxiety. So what you can do as a family is to send Emily to a therapist. So when she deals with anxiety and stress, then she's going to deal with seizure-like symptoms all together, and then it's going to go away. And I don't know about you, but this is a very common story I get from tons and tons of families who are feeling very dismissed and It just does not make sense because what they're seeing, just like Emily's family, is the physical symptoms. And why are they being sent to a therapist? Because it's an anxiety. Well, there's a missing link there too. And this is what led to family not giving up until they have the answer. So this is what led to family seeking second opinion with another doctor who was a neurologist. And this is where they found out Emily's seizures is not epilepsy. Okay, we got that checked. And then what Emily was having was actually called functional seizures, which is a type of functional neurological disorder, short for FND. And FND happens when there is a disconnect of communication between the brain and the body, even though your child's brain and the body are physically and structurally A-okay. That's why doctors cannot see anything on the scan or test. There is no physical damage to the brain or the body, but it is not communicating well. So it's almost like the brain is not sending the right signal to the body and vice versa, and therefore it causes symptoms like paralysis or seizure-like symptoms. So why does FND happen in the first place? You might be wondering. And what really triggers this brain and body disconnect? Well, this is what we're going to be talking about right now. So what causes FND to trigger like these paralysis and seizure-like symptoms, just like what Emily was experiencing? She was told that there's nothing wrong with the physical symptoms and therefore it must be psychological. Better yet, anxiety and stress and whatever else. And that is actually a very known misconception about FND. You see, a lot of people think that if there is nothing physically going on or wrong with the child's body, then it must be psychological. They are known to have this very dichotomy, like black and white. If it's not biological, it must be psychological kind of mindset, which is really unfortunate, but that's what the conventional medical model kind of fails to support families with FND. So back to what is really causing FND. Well, FND is caused by these three things: biological, meaning physical; psychological, meaning emotional; and social factors. Always there is a biological, psychological, and social factors going on. It's not just one thing. In fact, it's never a one thing that is causing. So back to the Emily, let me explain and let me paint the picture for you. So Emily was really healthy and very high achieving, straight A student who was socially outgoing, have a lot of friends, and having pretty good relationship with the family. What went wrong, right? You might think. So here's what actually happened. When the family was actually tracing what was happening leading up to that episode, they actually put two and two together that Emily had a concussive injury about 2 months prior to this symptom happening. And then since then, she actually was having a little bit dizzy and then having this constant headache. But because she is a diligent student, she kept going with her life. And so that is usually one of the biological factors that goes into it. And it could be viral infection, and it could be other illness that might be triggering this something that was cooking in the oven for a long time before the symptoms started to come to the surface. And Emily also had some sleep issues. Like she was having a hard time falling asleep, staying asleep, and then waking up in the morning consistently. So she was feeling really tired. And sleep and eating habits are also part of the biological, these physical factors. And she didn't have any anxiety or stress or let alone trauma. However, she was lacking these coping strategies and skills that she needed to have in order to overcome any struggles and obstacles in her life. So what was she doing? She was just internalizing, didn't say anything, and she was just trying to distract herself from anything and everything possible. So that is what I say, the emotional psychological factors. And she was also pretty hypervigilant about wanting to do really well. So she was a bit of a perfectionistic and also people pleaser. So that also goes into the psychological and emotional factors. And then social. Even though she was having a lot of good friends and family, positive relationship, she was feeling stressed about school and then a high achieving student and the performer, right? So she had this expectation about her and then she was giving herself pressure. And then she felt asking for help was a sign of weakness. Sounds familiar? So there's nothing wrong with Emily on the surface. And of course, you cannot really see anything about all of these things on the surface level. However, this is the mystery of FND. And just because Emily is a great student doesn't mean that she has to be punished by having this FND. So it's not her fault, just to be clear. And just like your child, it is really the combination of biological, psychological, and social factors. But all of these things lead to brain misfiring, miscommunication, communicating with their body, and so sending the wrong signal, causing these physical symptoms of paralysis or seizures or anything like that. However, nothing really shows up on the scan, MRI, EEG, and you don't really have to have a physical injury right in that moment that's causing the seizure-like symptoms. That's why it's called functional seizures, which is part of the functional neurological disorder. So if your teen is experiencing these symptoms and everything comes back normal, and then you know it's not normal, then it's time for you to really think about and then ask the right questions. So you are absolutely welcome to go back to the doctors you've seen, or even your child's primary care doctor, and then ask him if this is possibly FND, and have them walk you through what it is exactly that they're seeing that they may or may not agree with that. So you don't really need to settle for this unknown, uncertain things, or just having, oh, everything is normal, right? So now you have one more question that you can ask, which is the right question. Could it be functional seizures? Could it be PNES? Could it be NES? Could it be functional neurological disorder? They're all the same thing, even though they're different wordings. Ideally, you would find a specialist who knows what they're doing about FND so they can explain exactly what's happening. Otherwise, where you can start is the primary care, always, and then a neurologist referral. So you can ask a neurologist, could this be FND? And if so, could you explain what it is and help us understand how you got to the conclusion of FND, if it is it? And if your teen is struggling with seizures, but nobody is giving you the answers you're desperately wanting, don't give up. You might check out my program, Teen FND Academy, and then see if you qualify for the program. The link is down below as well. Thank you so much for watching this video, and I will see you in the next video.